Hi everyone and welcome. I'm Dr. Krystal Lynn Couture, the Pelvic Acu. My passion is sharing pelvic care with acupuncturists around the globe, really diving into the sacred medicine of the pelvis and using our unique viewpoints as acupuncturists to treat the pelvis in a holistic manner. This is why I'm so excited that my entire series on the pelvic floor and women's health is brought to you by the AAC, the American Acupuncture Council. I just want to take a moment to thank them and share my appreciation and gratitude for the American Acupuncture Council for sponsoring yet another video. In today's vlog, what we're going to be chatting about is the pelvic floor and its connection to fertility. So let's get into it. The table of contents for today's workshop includes chatting about fertility in Western medicine. In order for us to have an interplay with Western medicine as Eastern practitioners, it's super important for us to have an understanding of what's happening physiologically in the body. And that means understanding the male and female feedback loops that occur with the reproductive hormone system. We're also going to chat about fertility in Chinese medicine, of course. We're going to get deep into our chat about Tian Gui today, as well as revisit yin and yang. We'll have a look into the differences between Eastern and Western philosophy when it comes to looking at fertility within our clients. We'll also look at the connections or potential connections between the pelvic floor and fertility. And we'll look at a couple of studies and perhaps ask some questions that could infuse energy into future studies. And then finally, we'll chat about how to provide support to your clients that are coming in now with potential pelvic floor and fertility issues. So here we go. Let's begin with fertility in Western medicine. As I mentioned, in Western medicine, we're really dealing with the hormone reproductive physiology, which is really determined by the hypothalamic pituitary gonadular axis and the reproductive hormones, of course. There are both positive and negative feedback loops in females and in males. The stages of conception include the healthy sperm production, high quality egg production, and high quantity egg production, successful transport during ovulation of the egg to the fallopian tubes, transportation of the sperm to the fallopian tubes, and then of course the sperm penetration of the egg, which would yield fertilization, and then finally that implantation of the fertilized egg into the thickened uterine lining. Okay, so let's begin with these feedback loops. They might be a little confusing when we first have a look at them, but the key is to remember that whether a female or a male body, we are looking at this relationship and interplay between positive feedback loops, which encourage stimulation, and then negative feedback loops, which are the inhibition. So let's get our bearings around us. First off, GnRH is gonadotropin releasing hormone. This is released by the hypothalamus to stimulate the anterior pituitary gland. So you'll see in green on your screen the hypothalamus followed by the anterior pituitary gland. What happens here in the first phase is that the pituitary hormone, anterior pituitary, is going to release luteinizing hormone and follicle stimulating hormone to stimulate spermatogenesis and testosterone secretion by the testes. Okay, great. Everything is in balance, right? But the body has a natural system. The body is always seeking homeostasis. And this is actually something I learned in school in Western medicine before I learned it in Eastern medicine. The body always wants balance, right? If your ankle is off on one side, your hip eventually is going to go off, or your knee on the opposite side, because the body is seeking balance. The same is true of hormones. So the body in males has a natural negative feedback loop, which halts the overproduction of testosterone and the overstimulation of spermatogenesis. So in this negative feedback loop, what we can see, so that's marked by the red on the side of your screen, is that we have inhibin and we have testosterone, which are going to inhibit the secretion of GnRH, right, to the hypothalamus. And then that will then, of course, inhibit LH and FSH by the pituitary gland. We also do have a little micro feedback loop, which is that the Leydig cells will also stimulate spermatogenesis within the testes. So this is sort of the basis of what the male feedback loop looks like in relation to hormones. And we're really looking here at a quantity game. We're looking at the perfect quantity, and that's why we've got the positive and the negative feedback loop. In females, the feedback loop looks similar, but it is slightly more complicated in that we're not just looking at a perfect quantity, we're also looking at the cyclical nature, and that's based on what the uterus is doing, right? So again, we have our hypothalamus, we have gonadotropin releasing hormone, then we have the anterior pituitary, and then of course in this case we have the ovaries and the follicles, and then we have the uterus and the endometrium. All are part of this hormone feedback loop, right? The endocrine system. So the pituitary gland is going to release LH and FSH, so luteinizing hormone and follicle stimulating hormone, to stimulate several follicles to grow during that follicular phase, right? It's named pretty aptly, actually. So luteinizing hormone, follicle stimulating hormone, several follicles begin to develop within the ovaries. Check. That's our positive feedback loop in this phase of the menstrual cycle. The negative feedback loop in this phase is that the dominant follicle is going to begin to produce estradiol, which is the most common type of estrogen in the body. This can inhibit the GnRH, FSH, and LH production, and this is going to cause the endometrium to begin to thicken. So we can start to see how this process is a very unique and very complex interplay of hormones. A lot of things can go awry here. In our next phase, we have ovulation. During the ovulation phase, we're going to see that we have two positive feedback loops. So same system is set up, and in this phase, what happens is that luteinizing hormone and follicle stimulating hormone actually just stimulate that one follicle that is primary to mature. On the other side of the equation, we have the growing follicle continuing to produce that estradiol. And at this phase, it begins to stimulate the GnRH, FSH, and LH production. And then the LH will serve to promote to trigger the ovulation, right? So we can kind of see that this is an overall negative feedback loop becomes a positive feedback loop. In phase 3, we're going back to a positive feedback loop and a negative feedback loop. So luteinizing hormone in this phase is going to stimulate the formation of a corpus luteum from the follicular tissue that is left behind after ovulation. Okay, so that occurs within the ovaries. The corpus luteum is going to secrete progesterone. So now we have another hormone in play. And we see, if we look at my last presentation or any of the hormone graphs that are out there, we can see that progesterone peaks at this time in the cycle, right? When we have progesterone peaking, this is going to then inhibit GnRH, it's going to inhibit follicle stimulating hormone and luteinizing hormone production. This maintains the endometrium as the corpus luteum degrades and progesterone declines. This initiates the sloughing of the stratum functionalis. So we sort of have a basic understanding of these feedback loops. The key that I want you to remember here, even if you don't have a total understanding of it or can't remember it throughout the entirety of the cycle, is that this interplay can easily be jostled, right? We can impact the hormones in the body. We know by stress, by lack of activity, by lack of proper nutrition, right? So there are so many factors that can impact any of the phases of this cycle and these feedback loops. Excuse me, sorry about that. So that's the key. And that's where Chinese medicine comes in to really have an impact, because we come in with our needles and they're like, and our herbs, and they're like little lasers to target the exact parts of the body that need extra support, right? So let's just look for one sec at ovulation to implantation. And we can really see in this image, if we look at the ovary, and then into the uterus, we can actually really see that this is about an 8 to 9 day process from the oocyte being produced to fertilization occurring, and then migrating through the phases of cell development. So we go from that first cleavage to the 2-cell stage, 4-cell stage, and we develop over time into the 8-cell stage. And then we start to see the formation of the inner cell mass, and we start to see how that blastocyte is immigrated into the wall of the uterus, right? And that, of course, is the implantation. So again, this is another complex part of what's happening in the total picture for female fertility. Now, if we have a look at Chinese medicine, we're looking through a whole different lens here, a whole different world. And perhaps the two uniting is the key to creating successful fertility in women and in men. So Qing Shu, who was a gynecologist during the Qing dynasty, emphasized the unique difference between the blood and the menstrual blood. Blood is traditionally known to house the hun and to nourish, of course, the tendons, the sinews, the skin, the eyes, and the hair. The tiangui, or heavenly water, is considered to be the menstrual blood, which is derived from the kidney water and the female hormones of estrogen and progesterone. The liver is the link between the two. Thus, the tonification of the kidneys is what is one of the most important things to consider when we're working with fertility in Chinese medicine. Now, I made a little bit of a graph here to help explain what we have going on. So if we look at this graph, we can see that we have kidney water, and the impact of minister fire activates kidney water to become tiangui. And then we have the link between tiangui and blood, with the liver as the communicator between the two and the connection between the two. So let's talk about minister fire first. Prenatal fire formed at conception on the Du and the Ren axis. So minister fire actually exists before menstruation commences. Some texts say that it is the kidney yang that turns the tiangui red. It's just something to kind of play with there. At 14, the Ren opens and the Chang flourishes. And this is what matures that tiangui. So the minister fire also serves to worm the uterus and balance the yin, which yields potentially conception. It's a pretty exciting process when we really look at it from this viewpoint, right? The Ming Men is the root of the Yuan Qi and the residence of both water and fire. The yin of the 5 zang cannot nourish without it, and their yang cannot develop without it. So what we're saying here is we have this interplay. Once again, I'm using that term. We have an interplay of water and fire, where fire is not trying to overcome water, and water is not extinguishing the fire. And this is really existing within that role of the kidneys. So our system from Chinese medicine and Western medicine, we see some harmonization here, and we also see different and unique viewpoints. And these different and unique viewpoints play to the physiology and the energy or the nature of the system. And that's important to consider as we move forth with our chat here. So in my last presentation on menstruation, I shared this slide of yin and yang, and I'm going to share it again here so that we can sort of remind ourselves of how important the yin and yang, water and fire balance is within the body as we look at fertility. So during the menstrual phase, we have yang at its peak and yin at its minimum. Then yang and yin cross, they intersect, and the follicular phase begins where yin becomes prominent, yang starts to become less prominent. And here we have the ovulation phase when each of these is at its maximum. Then the yin becomes yang, right? And we start to see again that cross or intersect during the luteal phase. The yang begins to rise and the yin begins to fall. When we look at this and kind of blow up menstruation, we have during the menstrual phase, we have menstruation, the yang is going to peak and then drop. The qi and blood are going to be moving downward. We know that, right? Because we have the discharge of menstrual blood or tiangui. The heart is going to be the one who is discharging the blood. During this phase, the invigoration of blood is going to be important to move all of the tiangui out of the system. Next, we have the follicular phase. During the follicular phase, the yin and blood in the system are relatively empty. Yin grows and crosses yang. And in this phase, the kidney tonification and blood nourishment is really, really important since we know that we've got this emptiness within the system, right? Building back, right? This is a constant building and releasing, building and releasing. And there's two builds and releases. There's the release of blood or tiangui, and there's the release of the ovum, yang and yin, right? So these are really, really cool to kind of play with this interplay with. So in ovulation, the Chong and the Ren and the Du are going to be fully activated. They're going to be online. The yin is going to be at its maximum. The qi and the blood are moving upward. In this phase, tonifying the spleen to hold the blood is important when we're thinking about fertility and also strengthening the Chong and the Ren. Now, in the luteal phase, the yang is rising relatively rapidly, and it's warming the uterus, right? Needs to warm the uterus to prepare for that implantation of the egg, of the follicle, right? The qi moves during this phase, so it's important to both invigorate qi and blood. Now, what are the differences between Western medicine viewpoints and Chinese medicine viewpoints when we're talking specifically about fertility? So in Western medicine, we are looking at that endocrine function. We are looking at the hypothalamus, GnRH, and those feedback loops into the anterior pituitary, and then those feedback loops to the reproductive organs. We're looking at hormone balance. We are looking, hopefully, at organ function. And then we are looking predominantly at egg quantity and sperm quantity. And many of the interventions that Western medical fertility doctors provide are to specifically increase quantity of egg and quantity of sperm. This is a mechanical approach, and it is a numbers game. If you've worked with clients for fertility, you are commonly seeing labs being run and the look at the numbers being a huge part of this. In Eastern medicine, we have a different viewpoint. We are looking at patterns. We're looking at that yin and yang balance. We're looking at excess and deficiency. We're looking at heat and cold. We're looking at interior and exterior factors, right? We're also looking at system function within the collaboration of the elements and the meridians. Then finally, we start to look at the systems in more specific ways. So we're looking at the kidney water, the tianhui. We're looking at the liver blood. We're looking through a cumulative and holistic lens at the whole body and the patterns of the whole body. The entire symptom profile, the entire presentation of the client on the level of body, mind, spirit, and emotions is part of what we're looking at when we're trying to establish fertility. We're looking at the quality of the foods and the quality of the prenatal jing. So there are some significant differences here. Again, when the two are combined, is the collaboration going to be a unique solution to creating fertility in our modern world? And I think there's a lot to be said for that. I think that collaboration is the key and here's the if we don't start talking to and educating our clients and our children as a collaborative, not just as acupuncturists, as a collaborative sooner about how they're taking care of their bodies, what's happening in their bodies, helping them to understand their own menstrual cycle and their own fertility. If we are building health before the age of 14, before menstruation even arrives, before the maturation of sperm arrives, then isn't fertility going to be easier in the first place? I don't know. Just a thought I have. Okay, so our unique perspective in Chinese medicine. The TCM approach to infertility treatment integrates the menstrual cycle as a simple, non-invasive, sensitive, motivational, diagnostic tool to understanding a woman's fertility status. Right? So that's the nature that I talk about. It's the nature of the body is what guides us to determine fertility, which is really about overall health in the system. Let's chat here about the pelvic floor and fertility. While the pelvic floor, and there's a few studies that indicate this, while the pelvic floor is not likely a cause of infertility, there are seriously a few factors to consider. One is that if there is pain in the pelvis and tension in the pelvis, one may be less willing to engage in sexual intercourse because of that pain and dysfunction. That pain or dysfunction may put them into strange body positions throughout the day, throughout their life, but also throughout intercourse. So again, that can really limit the ability for the body to conceive. If there's pelvic floor dysfunction, and dysfunction, I left it broad here because we could think about pelvic floor dysfunction as incontinence, for example, of bowel or bladder. If someone is experiencing incontinence, it's going to be very difficult for them to be comfortable with engagement in intercourse, which can make it very difficult to conceive. Right? So there's sort of an indirect implication of how the pelvic floor can impact fertility here. But now we get a little bit deeper. If there's congestion or there's emptiness within the pelvic bowl, I think that can directly impact conception, right? There's blood, which could be stagnation. It could be that the blood is not holding. It could be that the blood has no motility. If the blood if the tianhui or the blood itself has stagnation, it's not holding, or there's no motility, I think it's going to be very difficult for one to conceive. If there's dampness or dryness, again, those fluids are not moving the way that they need to. And if the fluids are not of high quality and they're not moving the way that they need to, then that can create potentially a block with pelvic floor, which can impact fertility. There can be some physiological blocks as well, such as accumulations like fibroids, endometriosis. We can have prolapses. There can be altered spinal segment positioning or SI joint positioning. And certainly these physiological blocks can also prevent one from being comfortable in the phase of connecting to themselves, connecting to what's happening in their body, and being open to conception. When we are in pain, and maybe this is a great research study. I hadn't thought about that until now. When we are in pain, we are releasing different hormones, right? We are releasing a different set of hormones. So does the body have enough energy to then be at peak while it's releasing a peak reproductive hormone release while it's working through the release of substance P? I don't know. That's a good one. Injuries to the pelvic bowl are going to be another region. If there's a trauma, if someone had a fracture, a ski accident, something like that, car accident that impacted the pelvis in some way or the sacrum in some way, that can definitely be a factor that's going to at least contribute to fertility. And then, of course, energetic blocks. I think energetic blocks are definitely a contribution to fertility. And many of those exist within the pelvic floor because the pelvic floor has many sinew connections. It has all of the most of the meridians running through it. The conception vessel and the governing vessel, which if the CVGV is blocked in general, I think it's very hard to achieve conception through that state. And I've really found that in my practice. And then finally, the spirit or the emotions. Right? The pelvis is the root of the body. If the root of the body is holding emotions of trauma, well, again, do we have enough energy to then conceive within the body? What does it take? So there's a couple of studies out there that are sort of starting to touch upon a connection directly between the pelvic floor and fertility. So in this study in BMC Women's Health in 2024, this is like one of my favorite studies because it's the first one that really starts to investigate this relationship. So this study for the first time investigates the causal relationship between reproductive factors and pelvic floor dysfunction. The results suggested a causal relationship between some reproductive factors, but there were significant differences between female genital prolapse and stress urinary incontinence. So we're starting to see that these physiological factors are impacting reproduction. In another study in alternative therapy health medicine in 2015, there were 1,392 female participants treated in a clinic between 2002 and 2011. So this was almost a 10-year study, which is pretty amazing. And they had various diagnoses of infertility, including blockages of occluded fallopian tubes, hormone dysfunction, endometriosis, and some of the women were actually going through IVF. So the study was not specific, it was very general. So we have to keep that in mind as we look at the results. In the intervention in this case, the clients underwent whole body patient-centered treatments using protocols of manual PT, which focused on restoring the mobility and motility of the structures that affect the reproductive system. So specifically, they worked on those concomitant tissues around the pelvis, including, the back, the gluteals, the abdomen, etc. The manual therapy represented an effective conservative treatment for women diagnosed as infertile due to mechanical causes, independent of specific etiology. So this is another big important study. Basically, it's saying that with a very minimally invasive approach, utilizing manual therapy and no other interventions, utilizing manual therapy, we can impact what's happening in the structure of the body, which can positively impact fertility. So that's an important correlation to consider. But is there some missing data? And I think there is. Unfortunately, there are really just few studies that link the pelvic floor to fertility. And until this one in 2024, there were almost none that were done on fertility as a whole. Some on interventions, specifically like PT or exercise or acupuncture, but none in direct connection between what is that correlation of pelvic floor dysfunction and fertility or infertility, right? So I think there are some questions. What types of pelvic floor dysfunction are correlated with infertility? What percentage of both males and females with pelvic floor dysfunction are also struggling with their fertility? Does a weak pelvic floor contribute to miscarriage? Likewise, does a tight pelvic floor contribute to miscarriage? So is pelvic floor muscular dysfunction going to be contributing to one's ability to hold conception? And are there specific gestational stages during miscarriage that are more likely to be associated with pelvic floor issues? I think these are important parts when we look at fertility and the pelvic floor as a whole. So what can we do? Well, here are some pillars of pelvic patency, keeping the pelvic floor in an optimal state of nourishment and function. One is client education, and that is all encompassing. That can include helping the client to understand their body, to understand a little bit about what's happening during the phases of menstruation, to help male clients understand what is happening physiologically during ejaculation. Educating our clients on conception is really important. And this is something that is missing in their childhood. But if they're coming to see us in their fertile ages and they're trying to conceive, this is the first line that we can start with, is education. We can also begin to educate them on patterns that we see within their body. If they are drinking smoothies and eating salads every day and they have a cold and damp uterus, well, that's a contributing factor, right? We understand those patterns. So helping the client to understand the patterns that are going on in their body and alter their nutrition or other factors, lifestyle factors, to help their body, give their body the optimal chance for healing, that's a great way to start. We can also begin to educate our clients on posture as well. If we're talking about mechanical issues within the pelvis that lead to pelvic floor dysfunction, educating clients on posture. And this could be as simple as, if they have a desk job, that every 20 minutes they stand up, do a little stretch, and then sit back down, right? So that they can be in a place where their spine load is changed and they're not stuck in a sitting position. That anterior posterior tilt of the pelvis that they're stuck sitting in is going to contribute to what's happening within the pelvic bowl, right? Breathing. Breathing is so important. Encouraging our clients to get into the diaphragm with their breath, to take intentional breathing, to take intentional breaths is super duper important for the vagus nerve. And the vagus nerve has fibers that go all the way down to the pelvic floor. So it's really, really important to work in breathing. And the pelvic breath is specific to recognizing that so often when our clients are experiencing leakage in particular, but generally speaking, this is true as well. But if we think about leakage as our example, if they're having leakage, very often it's on the exhale. So they are sneezing, coughing, or laughing, and then that produces leakage. Those are an exhale, right? So the pelvic floor is actually functioning in that state in the reverse pattern of what we want. On the exhale, we want the abdomen. We know this if we're yogis or therapists in general. We want the abdomen to be coming in. We also want the pelvic floor to be coming in and out on the exhale. That's the excretion of air. That's sending the air into the world, right? That's the excretion. On the inhale, we want to fill and we want to relax the abdomen. We want to relax the pelvic floor. So encouraging our clients to understand the pelvic breath is very important. Finally, movement. Movement of qi and blood is particularly important to the health of the pelvis, right? Staying out of phases of stagnation is key. And also encouraging our clients to move according to their cycles is really, really important. At the beginning of one cycle, during the menstrual bleeding phase, the Tian-Gui release phase, it's important to consider that clients might be a little bit more tired. They're not going to be at their peak of exercise. During ovulation, they might feel great. They might feel like they can handle more exercise, more weight in the gym, a longer endurance activity, whatever it might be. And that's okay. And it's important for them to understand that their body feels different throughout these phases. And that's okay, as long as they find some way to move their body. Acupuncture. We are master technicians at working through patterns and helping to resolve imbalances. So acupuncture can really, really support our clients in treating those sinews, in opening blocks, and in nourishing the reproductive system in the exact way that it needs based on that presentation. And of course, dissolving, right? Accumulations is key too. And finally, if you're into manual therapy, which I am, I love manual therapy. It's a big part of my practice. Utilizing that manual therapy to help restore balance and establish embodiment. And this, if you're not trained in pelvic floor work, it doesn't have to be specific to the pelvic floor. It can be within those concomitant structures. Don't downplay working on the abdomen, working on the back, working on the butt, working on the anterior hips in order to support our clients going through fertility. Okay, so here's a little bit about my series with the AAC, the American Acupuncture Council. If you've seen me before, you've probably seen my pelvic floor intro as well as my pelvic floor and menstruation workshop. Coming up soon, we have a workshop on pregnancy, on postpartum, and on menopause, all in relation to the pelvic floor. Again, I want to thank you for being with me today, and I want to thank the AAC, the American Acupuncture Council, for hosting me through this series and sharing these blogs so that acupuncturists around the globe can get into the sacred medicine of the pelvis. Thank you so much for being with me, and I really, really look forward to seeing you soon.